This year, I will present the results of a research project performed using data extracted from the Italian MS register. The main objective of our study were to compare two different treatment strategy, the so-called early intensive treatment, which means using high-efficacy drugs as first therapy, with the escalation approach. The so-called escalation approach is based on the use of, let's say, more safe first-line agents like injectables or teriflunomide or dimethyl fumarate as a first therapy, and then escalate to an high-efficacy DMT if there is a treatment failure. There are some evidence which come from RCTs and some observational studies that an early intensive treatment approach is better in terms of reducing the risk of disability progression in people with MS. But still now, there are some doubts about the very long-term effectiveness of this approach. And another important topic is, can an early intensive treatment approach reduce the risk of reaching the so-called PIRA, the progression independent of relapse activity? Therefore, we performed this study by comparing these two treatment strategies in terms of disability trajectories and in terms of the risk of reaching a confirmed disability accrual event, both relapse dependent, the so-called RO, and PIRA events. We extracted data by using different inclusion criteria, and we obtained a total cohort of about 5,000 people with MS. By applying a propensity score matching procedure, we obtained two quasi-randomized groups of patients, which consisted each of 908 patients, who were well balanced in terms of clinical, demographic, and also MRI characteristics at the time of the first DMT start. Then, to evaluate disability trajectories, we used a linear mixed model for repeated measure. In this statistical analysis, we can estimate the value of EDSS score at fixed time interval, in our case, every 6 months for 10 years, by evaluating within and between group differences. Then we estimated the mean difference of the delta EDSS, which means the EDSS at a certain year minus the baseline EDSS. So the main results of this analysis is that patients exposed to the early intensive treatment approach accumulate less disability than patients exposed to the escalation approach. We then also compare the two approaches in terms of the risk of reaching the first 6 months confirmed CDA, PIRA, and RO event. And again, by using Cox regression models, we found that patients exposed to the escalation strategy were at a significantly higher risk of reaching a PIRA event. Therefore, our analysis, our results further confirm that the use of an early use of high-efficacy DMT can reduce the risk of disability accumulation over time in comparison to the escalation approach. Of course, we need further evidence, mainly evidence that can reassure clinician and patient about the long-term safety. But to date, our analysis can be applied and used by our results can be used by clinician to decide to treat early with high efficacy drug, especially naive patients with poor prognosis factors. The advice that can be done to physician is that when you see a patient with a classical prognosis factor, poor prognosis factor, a male patients with a high T2 lesion load, don't lose time, don't waste time with using moderate efficacy drugs, but start early and as soon as possible with high efficacy DMT.